Hello.
We can see your screen, ma'am.
My desktop to share my slide, and it's basically understanding our bodies, poverty and menstruation. I know as an advocate, actually.
Please mute everyone on board, please. Just mute everyone on board, please, because they are.
All right, sir. All right, sir. We've heard you. We've heard you. Thank you. You can continue, please, ma'am.
All right. Sorry for the viewers here and there. Once again, I would like to introduce myself as Dr. Bisari. And when it comes to sexual health, reproductive health, especially for young adolescents and women, it's actually a delight for me. It's something that I love talking about. And I believe we all are advocates in one way or the other. We are people who are passionate about women's health, we are passionate about impact, social impact specifically. And one of the bases of social impact is women's health. And I wanted to establish the basis of the fact of the reason why this conversation is important. And this is because women's health has little to the percentage of health budget that is allocated to it is actually small. And also looking at the rate of developing countries, we have little to no access when it comes to reproductive health. Basically, so many restrictions, little to no advocacy when it comes to budgeting, women's health budget. And the reason why this conversation is important is because many young girls even have no access to school, like access to education, because one of the first contacts of girls or boys or young adolescents to knowing about their bodies is in school. None of us get to know about reproductive health or integrated science class or even primary science. But how many young persons actually have access to this? So, and this is why it is important for us as advocates to go into the communities, not just restricted to the world of education, to the world of schools. So we can know this information, take it right to the community. And the reason why we need to know the basics is because if you don't, it is what you know that every other person, it is what you know that can give, or it is what you have that it can do. But if you have to know information about even the female body, you can just give information without really giving the right information. There are a lot of information out there, but the one related to the young person in relation to their age, because every information that is given in terms of sexual health, reproductive health, in terms of body, puberty, is also age specific. Not every information is to be communicated to every age group. So every age group has age specific kind of conversation when you are about to teach them about their body or even about the changes that happen to them. So I'll be going further to talk about what is puberty, because it's a basis that we can all take note and actually be able to communicate it in the right way. So what's puberty? Puberty is a natural healthy phase when the body develops from the child to adult, and this is always influenced by hormones. The reason why this is important is because I've had, and I'll be sharing personal experience based on my own field work, because this is how it actually relates to you and I. We are advocates. We are not a practitioner. Not everybody is a practitioner. But in terms of advocacy and how to actually relate to the people we meet on the field, and this is why I will be actually breaking it down based on my own personal experience as well. I remember that was in 2018. We had like our first project on the field, and we went to like a juvenile home for young adolescents. And one of the experiences I got to know, and one of the reasons why it becomes a sole purpose for me to advocate for the rights of young persons in terms of the male gender and even the female gender, is the idea that most of these young boys actually have to know knowledge about what is going on in their own physical body. Okay, so this particular day, we went to this juvenile home and we met, I think, about 200 males. There are about 230 boys, and most of them, they relate to one or two things, like how they got there, And one of the boys actually shared his experience. The reason why he became maybe a candidate or now in the juvenile home was because he has this experience. These wet dreams that young boys actually complain about, and they never, most of them are actually not aware that it's actually one of the signs of puberty. So this boy actually had like early morning erection and then had wet dreams, and this was like the first time it was happening. It was strange to him. Imagine a 10-year-old boy in juvenile home. This is what, and that was his experience because of this change, the changes that was happening to his body. Apparently, the stepmother, because the mom and the dad had been separated, and the stepmother just noticed that, okay, what's going on? There was no first knowledge. They beat him that, you bed white again and all of those things. And that happened. Going forward, this particular young boy again, while he was in school, he was just sharing his experience, because he actually goes to a public school, and he was just talking to one of his friends that, oh, this is what is currently happening to him. That I noticed that I always have this reaction very early in the morning and my bed gets wet. And because they were older boys, and what they advised him to do, they were like, he's not a man, and it's time for him, anytime he's feeling like that, he needs to grab a lady, and he needs to grab a girl. And this was just it was a funny kind of comment that these older guys were just passing along, and they were trying to just tease him. But he took it personal because he didn't know that they were just joking. And that was actually how this girl, the next time he had the early morning erection, and the next thing he walked up into the stepsister's room, and he wanted to rape the girl out of just what he had passing by from a older guy. And this was actually how this boy ended in juvenile home. This experience actually makes it clear that this is something that is right with us. So it's important that every young boy, every individual, even as a mother, as a sibling, as a younger person, as an older person, you are able to educate your community members, you're able to educate your siblings, you're able to educate any one person that you know around you. And this is what makes advocacy interesting, because every little information you know, especially when it comes to sexual and reproductive health, don't keep it to yourself. Please ensure that you are communicating, because this is actually how this will end up in juvenile, because there was a wrong information that was being passed across. And just a natural occurrence. This boy was just going puberty. And that's why it's important to know that puberty is actually a natural phase of life. It's like a natural early phase when the body develops from an adult. And these are the changes that happen. It can happen both for boys, it can also happen for both girls. So every young person, puberty for male in terms of age, different from puberty for girls. Puberty for girls, especially when it comes to girls, the age range is always between 8 to 13, and for boys, usually 9 to 14. It is said that for boys, it's a bit later, while for girls, it's actually more earlier in girls. The reason why this conversation is important, even for girls, because of the, what's it called, when it comes to teasing. When some young ladies, when they start growing breasts, because these are the changes that occurs in their body, they get teased most of the times that, oh, they are not growing breasts, they become shy, and all these changes practically affect what's it called, their sense of confidence, even their mental health, because these hormones are actually affecting every sphere of their life. And this is why this conversation is important for us to talk about as an advocate, because we are going to be going to the field, or if we are going to be meeting young persons, and you must know how to relate to them based on where they are. I have to see adolescents or young person as they are these people that they have this sense of superpower. They can do anything, and this is because their body is just growing, so they are exploring the different native identity that their bodies, their hormones are dictating to them. You will see a young adolescent that is very bright and very intelligent, and maybe in 2 days, 3 days, if someone that is smiling in 50 seconds now, she can turn to someone's friend and tell that she doesn't want to talk to you. And this is because these are the changes that is going on in them. Their hormones their body changes, so many things is occurring at the same time. And for most of them, they're unable to understand how to navigate through these cases. And this is why this conversation is important, so that you and I can help them to give them the right information and teach them on how they can navigate through this space appropriately. And as I said, another thing very important, especially when it comes to young ladies or young girls generally, or let me call them adolescents. Adolescents is actually a group of young person between the age of 9 to 15. Adolescent, yeah, 9 to 15. Why young persons usually between the age of, I think, 9 to 21. So like it's actually very important that we have like a basic understanding of the age group that we're actually dealing with. So another thing we must know is that everyone's timeline is unique. Earlier or later, it's completely normal. So as long as the changes, especially when it comes to young ladies and also to young persons rather, the changes that occurs in everyone's, the changes does not occur all at once. And for every single person, whether you're a male child or you're a female child, it's different. The timeline differs. Even for individuals, imagine bringing 5 young girls together. The changes they will experience differs from each other. And this is fine. This is okay. Another myth I really want to break today is that please don't ever think that every young girl has the same. Everyone has 28-day cycle. 28-day cycle is like a myth. Not every young girl has 28-day cycle. And this is under the structures of the changes that happen to young persons, especially when it comes to these young girls, adolescents. These are the things that characterize their puberty changes, especially the onset of menstruation. And menstruation is actually a vital key changes that happen in young girls, because at this point in time, not every but not they are not used to it. They are not used to seeing blood. They are not used to seeing it. So I would like to define menstruation as the shedding of internal lining of the uterus, and it is evidenced through the blood that they see. And the shedding is like every month, the body actually goes through this cyclical change, which is powered by hormones. So for every young lady, they actually have different, every woman, the way I used to say that a woman is always in cycle. Imagine every day of your life you're in cycle. And so see it as a young girl who has never experienced this phase before. Even when she has had people talk about it, she has never experienced it. It's not her experience. So still need to work. And the reason why we need to talk about it is because menstruation in the context of Africa has been viewed as a what's it called? As an I won't call it a bad thing, but the way everybody see it as in Yoruba now they call it alejo, visitor. So they make it look as it's something that is strange. They make it sound as if it's something that we should not talk about. And this is why we need to normalize the conversation, even as a male young adolescent, as a male adolescent, we should let them know that this conversation of menstruation is normal. Because this is actually how you can support the female gender. Even knowing about it and also becoming a responsible adult as time goes on. So the reason why this conversation is important is because I believe every advocate needs to know about menstruation. Even if they are not advocating for good quality health and good quality health, if you are not advocating for SDG3, you can still you need to know about menstruation, because menstruation is the basis of the acceptance. If you want to talk to any girl child, I've made pain points around that phase of her life is menstruation. Every young girl worry about menstruation. Let them not tell you that, oh, I don't want to hear about it. Because at every point in time, they are thinking that, oh, in the next few weeks now, this blood is still coming. So like they are always bothersome, actually hate the idea of menstruation. And most of the time when we go on food project, one of the things the students they will want to confide. I don't really like to see my blood. I don't really like to see this whole blood thing. The reason why they don't want to see it is because of the emotional and hormonal changes that happen during that phase. it's not only because of wearing pads can be burdensome or can be very uncomfortable, but what makes it uncomfortable is more of the emotions and the hormonal changes that happens within their body. As I said, menstruation is actually a phase of the whole cycle, a phase in the menstrual cycle in which the internal lining of the uterus is shed away and it comes out from the body through the vagina. That's actually what menstruation is. It's just the blood fluid that is extruded from the uterus through the vagina. And this happens every month. Imagine a young lady going through this every month. And one of the things I like to say is that imagine every woman in cycle every day of their lives until they attain menopause. So the active age of our lives as a young woman, as an adolescent, you are practically in cycle. So it's very important that this conversation we have it, because by the time you understand what menstruation is, its role in your emotional, even in your intellectual life, and even in your health generally, you'll be able to know, oh, these are my active seasons. These are the days I'm actually more going to be like I'm going to be, I'm in myself. So you could tap into the power of your hormones. You could tap into the powers of your cycle. I think that's the way I like to say it. And the reason why this conversation we need to talk about it because, as I said, every young lady, every young woman is in cycle all the active days of their life. Menopause is that phase where the menstruation itself ceases, and menopause is not attained until it's usually between 45 to 55 years. So imagine someone that has been menstruating since the age of, let's say, an average of 10 at the age of 10. The person menstruates from 10 years, and maybe at the age of 45, they stop menstruating. So you can imagine 45 minus 10. That's like 35 years of their life, they are actively menstruating. And it's said that 35 years of your life is actually your most active phase of your life. So, and this is why this conversation is important, so that if every woman, understands their body, they can actually tap into the power of what they know about themselves. So one of the phases of the major thing that we need to talk about is the menstruation, which is one of the changes puberty that happens to girls, adolescent girls. And one of the reasons why I want to stay on this menstruation is because it's actually the ball game of what makes the women's health, from diagnosing disease condition to diagnosing what's it called, fertility, to menopausal syndrome, endocrine syndrome. So every disease condition that I can think about, menstruation can actually be an indicator to that. So, as I said, menstruation is just one phase. How many phases do we have in a cycle? We have about 4 phases. And the way I used to say is that women are always in cycle for at least for an approximate 5 years of your active years of your life. And imagine you being in this cycle every time. Menstruation is the first phase, and the average days is meant to be 3 to 5 days. 3 to 7 days rather, sorry. So the average day for menstruation is 3 to 7 days. And the thing about it is because the reason why this day is very important. When it is lower than 3 days for 3 consecutive months. So you can't say, oh, something is wrong with your menstrual cycle or with your menstruation generally until it's like a constellation of changes to your menstrual cycle. Constellation of changes in terms of the menstrual flow itself. So menstrual flow is expected to be within 3 to 7 days. Anything lesser than 3 days, happening for 3 consecutive months, that's an indicator that there's something going on in the body. That's one. Another is if the symptoms is if you are menstruating for more than 7 days for 3 consecutive months, it's also an indicator that something is going on in the body. So you can't conclude that something is going on until you have it, until it happens like 3 consecutive months. Another thing I would like to establish is also the menstrual cycle. The menstrual cycle is like the whole cycle of compiling the whole 4 phases. I initially said menstrual phase is the first phase, which is only 3 to 7 days. The second phase is the follicular phase. And follicular phase is meant to last for at least 8 to 11 days, depending on the cycle. Then we also have the ovulation phase, which is just 1 day, it's just 24 hours, which is usually the midday of the cycle. And then the last one is the luteal phase. And luteal phase can last from about 10 to 14 days. So the reason why we need to calculate this cycle, we should also have an idea of what the cycle is. So the cycle is like a range. And I always say it's not every time someone has a regular 28-day cycle. And 28-day cycle is a myth. It doesn't happen like that because anything can affect it. So as I said, as I mentioned, all these four phases, the menstrual phase, the follicular phase, the ovulation phase, and the luteal phase. Calculate all these numbers together. It's going to be within 21 to 35 days. Anything lesser than 21 days for 3 consecutive months is also a sign that there's something going on in the body. Anything greater than 35 days for 3 consecutive months also signifies that something is going on in the body. So how do you want to relate this to a young person you met during, and this young person, people like that for the last, let's say, for the last 2 years now, I started my menstruation. Maybe the young lady is like a 12-year-old lady, and almost all our colleagues in our class, or let's say 30, let me use 15 years. This young lady is 15-year-old, and based on her body structure, she's slim, she eats less, and she menstruates about just 2 days, and the next time she sees that period is like after a year, and then she walk up to you and say, oh, I started my menstruation like 2 months ago, and I started my menstruation, I saw my menstruation last year, and that was the first time I'm ever seeing my menstruation, but since after last year I've not seen it. Is there something wrong with my body? Do you think I'm okay? So one thing I've actually realized from study, if someone just started their period, one of the symptoms is this: when they start at first, they might not see it for the next 6 months. They might not see it for the next 6 months, especially for first timer. But the moment the person saw it once and it goes for like 2 years and the person did not see it, that's the problem. So after 2 years, it's expected that there should be an institution, like there should be a medical intervention. Let me just say it that way. There should be a medical intervention. So the person can actually see a period for maybe once or twice in a year after she just started, and the person did not see it again. After 2 years, and the person still did not see the period, the person should see a doctor. The person should consult a doctor, because in that case, the person needs like an hormonal assistance to ensure that the period is normalized. So these are the conversations, because these are the things many young person keep asking. Another is, oh, my period is always 28 days, but I realized that it's no longer 28 days. So what will you tell them as an advocate advocating for menstrual health advocacy, menstrual health and hygiene management? So the response will be 28 days is normal for many persons, but for every single young person, there's always different things that affect that 28 days. It's not always 28 days, it's a range. It's usually between 21 to 35 days. So as long as when you calculate your period, from the first day you saw your period, and the first day you are seeing it in the next month, as long as the range is between 21 to 35 days, it is normal. So let me give an example, which is actually the best way to calculate period. 21 days is the minimum, and 35 days is the maximum. So imagine I see my period maybe on the 1st of this month, and then I'm seeing it again on the 31st or on 29th of this month. 29 minus 1, that's 28 days. So it's assumed that I in the same month I menstruated twice. But as long as the month difference, I mean the interval is still within 21 to 35 days, is normal. And this is actually the best way to calculate the period. The first day someone is seeing their cycle, the first day you are seeing your period is the beginning of the cycle. The whole cycle average is meant to be 21 to 35 days. That's why when someone say I'm a 28-day cycle, I'm a 35, it's just the interval between the start of your period and the start of another period. So the interval between that date is meant to be 21 to 35. So it's an average. So for most persons, actually, those who just started, their period sometimes can be 22, can be 23, and later it starts adjusting. And all these are normal. Normal menstrual cycle is between 21 to 35 days, not necessarily have to be 28 days. So another thing is, because these are the questions young person ask, oh, I menstruated twice in the month. You have to tell them that, okay, calculate from the first day you saw your period last month, or even it might be the same month, and the first day you are seeing it again. What's the time interval between it? If it is still within 21 to 35 days, it's normal. But if it is more than 21 to 35 days, if it's more than 35 days or less than 21 days, on 3 consecutive months, and it happens like that for 3 times consecutively, it's not normal. So the person needs to see a doctor, because it can be an indication for many other disease conditions. Another thing which I would like to emphasize, because I can't really say everything I want to talk about today, because the menstrual phase is one important phase that we need to know, because it actually is a pointer to different things in the body. So another thing young person, the changes that they experience is also the blood. What is the blood type that is being seen during period? So some persons say, oh, my blood is always very dark and I see clots. It's actually when you start seeing clots almost every time someone is on period, it can be a pointer to the fact that this person actually is having uterine fibroid, and then a painful period. It comes with the symptoms of uterine fibroid. At every point, the blood is always heavy. So someone used to ask me that, okay, what's the volume? What is the volume? Because which is another thing we need to know. What is the volume of menstrual flow? I won't give, because most of the study you see online is also based on American studies. But in Nigerian study, I've not really seen so much. But based on your body type, based on what you eat, based on the number of pads. So this is what I used to say. Is the pad you use, is it fully soaked within, like let's say within 4 hours, someone has changed and the pad is fully soaked, and then the person have used more than 3 pads? It's not normal. It's not normal, because it is said, based on study, that the average number of blood throughout your whole cycle, is meant to be about 5 to 8 tablespoons. And that's when I saw that study, I knew that study is not for us in Nigeria, because not many persons will menstruate and just 5 to 8 tablespoons. It's always more than that. So how do you quantify it? So the way to quantify it is that if someone is menstruating and you have to change your pad for almost 4 times in a day, or more than 3, anything more than 3 times, and both are fully soaked with cloth inside, just know that there is something going on with the body and it's not normal. So as I said, when the flow is also more than 7 days, it's not normal. When it's also less than 2 days, because another thing is that if blood flow is also low, it's also an indicator that there is something going on in the body, especially when there's an hormonal imbalance. For persons that have PMOS, which is no longer PCOS, those kind of conditions, many young persons actually lost their period for 2 years, some persons 1 year. And when the period eventually comes, they menstruate for almost close to like 10 days, 12 days, heavy flow. And these are the signs, and these are actually indicators that something is going on with the body. So another changes that actually happen, I actually want to go through the whole phases. The follicular phase, which is actually one of the important phases. I used to say it, as long as every young person that reached puberty, a young girl actually has approximately 400,000 eggs. So imagine if you have 400,000 eggs, it's plenty. So how do you get to use this egg? And that is actually the whole process of follicular phase. In the follicular phase, the hormone follicular stimulating hormone is trying to release one of the best eggs for ovulation. So every month your body wants you to get pregnant. But when you fail to get pregnant, what you see is menstruation. So what happens during this phase, in follicular phase? So in follicular phase, your body is preparing to release the best egg. And this phase is actually very important because for many persons that actually have ovarian cyst, when multiple eggs are being released at the same time during ovulation, during follicular phase. Follicular phase, as I said, is preparing your body to release the best kind of egg. I'm so sorry, my everywhere is dark right now. So but can you all hear me?
Yes, ma, we can hear you. Continue, please.
So the follicular phase is actually an indicator to the body, and that is when the eggs are being released. And as I said, imagine 7 days after your period, then after like maybe like 5 to 7 days later, or 7 to 10 days later, 7 to 10 days later, you are in your follicular phase. And it is this phase that you can actually, I would say, for people, that is your safe period. I used to say the safest period is always immediately after your menstruation. And for that follicular phase basically is your safe period. And what I mean by safe period is the time when a young person, especially for, I'm not in support of, I know I advocate for sexual and reproductive health, but I'm not in support of sex before marriage. But for some persons that actually want to go to, exploring different sex, this is actually the phase that, menstrual cycle. So in the follicular phase, and just immediately after your period, which is usually immediately after your period, is considered your safe window. So you can have sex and not get pregnant for those who have regular cycle. So the follicular phase, as I said, your body is preparing to release the best egg. So the hormones are on the high, the follicular stimulating hormone, the estrogen is also warming up to start getting high, but it's still low in this phase. And when you get to the follicular phase, the body tends to also, in a way, release more eggs than usual. And this happens for those who always complain of ovarian cysts. Like, just even before my ovulation, I started feeling this right abdominal pain shortly after my period. My period has gone, but I still feel like after my period, some few days after my period, I still notice I'm having severe pain. And this pain always, they will tell you that is in my abdomen. It's just around the left side of my abdomen, lower part of my abdomen is always very severe. And this is always because of, during this follicular phase, because of these eggs that are being released. And when these eggs are being released, egg is released during the ovulation phase. But most of the times, because the follicles are trying to also, release the best of their eggs towards ovulation, so towards the ovulation phase, they release more than one egg. And what happens in ovulation is that the best egg gets to meet the best sperm. But in most time, some of the eggs actually do not, they do not die off. So they still stay back. And that's why someone will say, during my ovulation, I'm having severe abdominal pain. And this is because of these eggs that stayed back. Instead of them to die off, they still decide to stay off. And what they did is that they begin, instead of them to move, maybe into the uterus and all, they didn't go to the uterus. They stay within the ovaries because the ovaries is responsible for the release of the egg. So when this egg stays there, they form what is called ovarian cyst. So instead of them to shed away or to die off, they begin to form pouch of water. And this pouch of water can become a collection for infection. And that's why most of the times people say, I'm also running fever, almost around my ovulation phase, I'm running fever, I'm just sick, instead of you to be very excited. And these are medical conditions that happen towards that phase, during that follicular stroke ovulation phase. So in ovulation phase, what's happening? The release of your best egg, and it's always meant to be 24 hours. But what happens most of the times, when people say, after my ovulation phase, I knew that I ovulated, how come I'm still getting pregnant? And this is because the egg that you release has the ability to stay within your uterus and not die off for the next 72 hours. So imagine an egg that's been released since like maybe 3 days ago, but it's still within the uterus and it's still very fertile. So, and that's why most of the time when people are saying, okay, I want to conceive, especially when it comes to women's health, maybe you're advocating for sexual and reproductive health, and someone is telling that when is the best time for me to get pregnant, and you've told the person it's only in your ovulation phase, which is only just 1 day. It's not just 1 day. Yes, ovulation phase is just midday of your cycle. Like for someone who is 28-day cycle, they will say it's day 14. For someone who is 21-day cycle, they will say it's day 11. For someone who is like 35-day cycle, they will say it's like day 35 divided by 2. It's the midday of the cycle generally. And the reason why I like to also emphasize that, because many young persons don't have a stable, just like the month is not also regular. We have months, some months we have 30 days, some months we have 31 days, some months practically your body is changing every time. So it's not every time your cycle, the interval between your cycle is always 28. It's not every time you have the same number consistently. So how do you know your menstrual cycle length? So as I said, not everybody has a constant day. It's not every time I have 21 day, 21, 21 day. It's not every time you have 22, 22, 22. It's not every time you have 28, 28, 28. It's a myth. So how do you calculate your regular menstrual cycle? And it's like an average. So you did an average of, if you see your period maybe on the 28th last month, you saw maybe on 29 on the previous month, you saw maybe you have 28, 29, 30. You add the 3 together, 28, 29, 30, divided by 3. The average of that month, it will usually fall between 28 to 30 as well. So what will you do? How do you know your mid cycle for ovulation? So your ovulation will be around most likely day 12, 13, 14, 15. So what we say is that during that phase, for someone that is trying to conceive, have sex or just be sexually active around those 3 number, those windows. So just like, even if you want to also calculate your next menstrual cycle, you expect it maybe 2 days before or 2 days after your expected, maybe your expected average that you have calculated is 29. So you should be expecting, okay, maybe most likely maybe on 28th, or most likely on 29th, or most likely on 30th. So it's like an average. It's not like, oh, the next time I'm expecting it must be certain 28, it must be certain 21. There's nothing like that, because there's so many things that can affect your body. Exercise. If you travel today, you change environment, it will affect it. If you change your diet, your body will change. It will affect your hormones. So many things affect the women's hormone, and this is why it's not like a fixed what's it called, it's not a fixed date, it's not a fixed timing, but you have you work with an average. So it's that average that will make you know your safe period. Is this average that will make you play safe and play smart, and also plan appropriately for your next cycle. So another thing I would like to establish, which is actually the changes that happen within the body for young boys and for young girls. These are normal things. Hair growth, hair changes. For boys, they begin to grow more, the beards, and also growth of hair within their pubic region. Also for female as well, there will be deepening of voices, which are normal things. I think I went to a school lately, and I was like, everybody's in puberty in this class, and they were like, no, me, I'm not in puberty. I said, and I asked somebody, what changes do you see in this person? And they said pimples. I said, yes, almost half of the class have pimples. So one of the changes is also the skin changes, which comes with pimples. And this is one of the reasons, because these hormones that affect the growth of the reproductive system also cause skin changes. And skin changes like the pimples, even some young girls become lighter, while some persons become darker. For guys, some guys actually become more darker because of their hormones, testosterone. And then for the female, we have the estrogen, and estrogen is always very high during ovulation. And the reason why I think I need to go back and emphasize on these hormones is because ovulation can be seen as the phase where, imagine a young girl already said no during her menstruation and said, oh, I'm not interested, please. Maybe someone is asking her out, and she just hurriedly, because of her hormone during her menstrual phase. Because in menstrual phase, estrogen is low, progesterone is high, they are moody, they are cranky, and you understand. Those are things that happen during the menstrual phase. In the follicular phase, they are just, there's this withdrawal symptoms. They are just trying to recuperate themselves. They are trying to get themselves again. That's in the follicular phase. The hormones that are actually very high in this phase, you have the prolactin. Estrogen is also, is picking up, is like mild. And then, these hormones are just picking up. And then you see someone that normally they used to be very, what's it called, very, very active. They just say, I will do it later. I will do it later. That's like in the follicular phase. They tend to withdraw from what they usually want to do, because their hormones are just starting to pick up again. But in the ovulation phase, which I said just one day, but most of the time, because these hormones are still kind of high in the body, estrogen can actually be as high for the next 5 days. So the person is very, very quick to action. You see the person very active at home, cleaning, mopping, very energetic and all. And this is normal. Another symptoms that I believe that we should also look into, which is also the breast tenderness and the breast pain rather. And this actually occurs during ovulation and also during menstrual phase. And the hormone response for that is just the prolactin hormone, which is always very high during ovulation and also slightly high during menstrual phase. And that's why many persons, we always advise that, okay, when is the best time for me to check my breast? We always say just immediately after your menstruation. That is the best time to check your breast, to just check for any lump. Because another thing we need to know is that talking about the female body or the body generally does not exclude the breast. It might not be part of maybe the sexual reproductive system that is within the the genitals, but breast is part of the female reproductive health. And that's why it's important that alongside, if there's any hormonal changes, you will see some young ladies complaining that they have breast discharge. And that's because of high prolactin hormone. And when prolactin hormone is high, it actually causes a decrease in luteinizing hormone. So these hormones they have this kind of feedback mechanism. They affect each other in one way or the other. So I'm not sure if I'm giving too much information, because I feel like this is becoming more medical. So, but I just want us to have an idea that the breast is also part of the female reproductive system. So you can't talk about menstruation without, or we can't talk about the changes that happen in the female reproductive system or puberty changes without not talking about the breast, because the breast is part of the breast enlargement, which are the changes young ladies experience during puberty. The other one, as I said, which happens to both gender, is the growth in hair, sweat, excessive sweat, which is more in the male gender. Male tend to sweat more than female. The growth of hair. And then the reason why this conversation has to be normalized among the male gender is because we have to let them know that they are also important in advocating for the rights of the female child. They are also important in advocating for the rights of the girl child. Let's not exclude them in the conversation. Let them be part of it. Let them know about what ovulation is, because when they know, they won't stigmatize the girl child. They won't say, "Oh, she's on her period," and they'll be laughing, ha ha ha. Or oh, she's stained, ha ha ha, and they'll be making fun of her. Because those are the things. As I said, for an adolescent during this phase, their emotions are actually very is very fragile. So imagine a young person that maybe she's not in she's in luteal phase, and in luteal phase, one of the characteristics is they are always moody, and that phase is meant to last for 10 to 14. It's like 2 weeks before my next period. And the reason why this phase is very important is because it's like a withdrawal symptoms. Your body after ovulation, and then you do not get pregnant, your body starts to find a way to shed off the egg. And the way it shed it off is by releasing this luteinizing hormone and progesterone. So there's like a withdrawal. Your body's it's not feeling itself again. So that's why most of the time, a week to your period, to the next period, you will see some young ladies saying that they have this premenstrual syndrome. They call it premenstrual syndrome because, like, a week to your period, the luteinizing hormone is very high, and because it's trying to get rid of the egg from from the one you failed to fertilize, and then the next phase continue again, which is the menstrual phase, and then you see the evidence again, the evidence of your of you not getting pregnant as blood, which is the menstrual phase again, and the cycle continue like that. But in the luteal phase, the reason why that phase is very important is because of the progesterone. Progesterone is responsible for the release that muscle cramp, the muscle pain, the every kind of pain a young girl experience. I said progesterone, prostaglandin rather. Prostaglandin is also very high. So prostaglandin is the one responsible for the pain. And the reason why I need to talk about this is because the first symptoms a young lady experience during menstruation is the menstrual cramp. But it becomes abnormal if it prevents the young lady from her normal activities. And the reason I'm saying this is because we are in a culture or in a system where pain has been normalized. Pain has been said to be the normal thing. If you don't feel pain, which means you are not yet a woman must be able to endure pain. But pain is not normal. Pain is not part of the scheme of creation. So, and that's why I always say menstrual cramp that prevents you from your normal activities. If a cramp prevents you from eating, it prevents you from going to class, it prevents you from doing maybe washing or even cooking, it's not more normal. And there are so many myths that because of being an African people, there are myths like, oh, when you're on your period, you should not be cooking moi moi. When you're on your period, there's so many myths which we need to debunk. Another thing is that when don't discard your menstrual pad in the night, because don't dispose it openly. There's so many myths basically, because they said they will use your blood, that will not be able to get pregnant. Those are myths. So, and these are the conversations we need to have, because they are not valid. They are not valid. Another reason why we need to talk about this is because any pain, please don't normalize pain, because pain is actually an indicator that something is going on in the body. In cases of endometriosis is just like, imagine something else, a tissue growing within your womb, and it's always followed the time when you are not this one is not fibroid though. It's not fibroid. Endometriosis is just like something is going on with your body, like a foreign growth, but it is within your uterus, like it's bleeding alongside with your period. Sometimes it might not even be during your period, but most of the time it's always during period. And they tend to simulate your normal menstrual flow, but it's not normal. It's like a foreign tissue that is bleeding. And the reason why this is important, because in conditions like this, the pain is always severe. It's always severe. And for some young persons that actually have like a imperforate hymen, I understand, and that's one thing I used to say. The indicator for virginity is not hymen, because virginity simply means someone does not have sexual intercourse. And that's why many persons is trying to debunk the whole study. Someone can have like an imperforate hymen to the extent that this hymen is closed up. Every one of us actually have an hymen that has been opened, and that's why your period can be able to come out. But it's how tight it is. And in our previous ideology, as people of African descent, we always say that the hymen have to be tight. And that's why many women that time, they always have severe abdominal pain, severe pain. Because imagine if the hymen is too tight, how will the blood come out? Anyways, maybe I should just try to also say this. Hymen is just like a nylon. Even nylon is thicker than it. So it's just like a very thin lining membrane that covers the cervix. It covers the vaginal area. It's very thin. It's very thin. It's very thin. It's just almost before you get to the cervix, and it's very thin. And for many young persons, they don't even have it. But for persons that actually have imperforate hymen, it means what this means, that it doesn't have any perforation. The reason why you are menstruating and you can see blood coming out is because you have a perforated hymen. The hymen actually has been perforated. But to the degree of what people call virginity, is like the whole hymen is it has not, maybe the perforation is not much. So if you see someone is menstruating, maybe the blood is small. The person is menstruating and is using just maybe one pad, and that pad is just a stain. For someone that has imperforated and the person is having severe abdominal pain, the pain is so chronic to the extent that the person will be vomiting, will be stooling, stool will be having blood stain, because the blood wants to come out, but does not have any other ways to come out. It's coming out through stool because the hymen is imperforated. It doesn't have any perforation where the blood will come out. And these are the conditions. And this is not anything to glorify about. Imperforated hymen is not normal, and it's the way they will do it, they will have to open the hymen. And imagine if you see a young person that went to they did a procedure on her, and they told her that, oh, the reason why she's having this severe abdominal pain is because her hymen is very thin, but we need to open it up. Does that make her no longer a virgin? No. So what is the ideology of virginity, which is even one of the things we also have to talk about? Because so many young girls hide on the umbrella that, oh, as long as my, what's it called? As long as my hymen is still intact, I'm a virgin. Virginity is actually all about sexual intercourse, and sexual intercourse either through oral, anal, or vagina. Those three routes, either the person is having sex through the mouth or having through the sex through anus, is no longer a virgin. It's not about the hymen at this point. So it's more about intercourse through these different routes, through the vagina, through the mouth, and through the anus. So if someone is having sex, you might not have it through the vagina, but you've had it through the mouth, or you have it through the vagina, or you've had it through the anus, you are no longer a virgin. So the whole concept of virginity is just all about sexual intercourse through these three routes: oral, vagina, and anus. So imagine if someone has said, oh, I'm a virgin, but my hymen is intact, but they never disclose. Oh, you now ask them that, have you had sex through the anus? Have you had sex through mouth, orally? And you say, maybe, but I'm still a virgin. No, as long as that was sexual intercourse, which is usually penis entering any of these canal, any of this opening, the person is no longer a virgin, and is not a respect of the hymen. So basically, that's actually one of the things I just want to say here. Another thing which is very important, which is the aspect of contraceptive. I'm sorry, I'm trying to talk so much within a space of little time. I'm really sorry if I'm taking much of our time, because I'm really open. I know that the whole concept of sexuality is very, very important. And menstruation is one factor that we need to talk about, because of the whole idea of women's health, girls' health, young person's health, because we need to normalize this conversation. So another thing I really want to talk about is the aspect of contraception. And I think in one way or the other, I've talked about it. And one of it is the what's it called, the calendar method. And that calendar method is just what I just explained, that you have sex during your safe period. Your safe period just shortly after your menstrual flow, and also during your luteal phase. So the luteal phase, which is shortly after your ovulation phase, you can have sex around that period. It's said to be your safe period. So you can think about maybe like for someone that is menstruating for 3 days, after you finish your menstruation, you can start having sex from day 4 to like maybe day 7. It's safe for you. And for someone that's the other, which is luteal phase, and then maybe you saw you ovulated maybe on day 14 or day 15, day 16, can then start having sex. Let's give it a gap, like from day 20 or day 21 to like 27. It's said to be a safe period, but that depends on you. So another thing I always say is this: safe period is safe for those who have regular menstrual cycle. Regular menstrual cycle in the sense that you have like your average are consistent. The average of 28, 29, 30, you menstruate around the 20s and it's always regular like that. Maybe you are someone that menstruate around 27, 29, 30, 28, 20, it's around that. You have that average. Or for someone that has 21, you menstruate around 21, 20, 22, 21, 22, 23, 20. You have that average consistently. Do you get? That average is consistent for you. Those ones are it's said to be safe. You can have consistent safe period like that. So you can have consistent menstrual cycle like that, and it's said to be consistently safe for you. So why is it important for us to know about contraceptive option? I used to say, you are the one who know that you can do abstinence. Abstinence is said to be 100%, but not everybody can do abstinence. So if you go on a field trip or you go on a community project and you are telling every young girl that you see, abstain, 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 abstain. Sorry, please, can you share this slide? Sorry. And you are telling someone to abstain, abstain, abstain. It might not work for the person. So what do you need to introduce to them? You need to introduce to them other options that are available. And the first option that is usually available that anybody can use any day, anytime, and also prevent sexually transmitted infection is condom. Condom is safe. And we have two types of condom. We have the female condom and we have the female condoms. Condom is safe 98%. He said 95 to 98%. It is safe to use condom. And because the reason why condom is safe is also because it also protects against sexually transmitted infection. Another one that I used to say, which I used to advise, please don't use it because it will mess up with your hormones badly, is Postinor. I have seen a lot of patients, a young person, they walk up to clinic and they'll say, oh, I say, oh, have you used contraceptive before? They will say no. And then I will now ask them, have you used Postinor before? They will now say yes. Postinor is a contraceptive. Whether you use it every 2 or 3 days, whenever you have sex, it's not safe for you. It's a form of contraceptive, it's an emergency contraceptive, and it mimics your hormones. It mimics the body hormones. And when it mimics the body hormones, it tampers with your body system. So this is the way I like to say it, because what is in Postinor is majorly progestin, which is progesterone. And progesterone is like, the body has like this feedback mechanism. So if your body is telling you that you now have, because you've introduced Postinor to your body, which is a one-time thing, or you only use it once, maybe after 5 days again, use it again. At every point in time you are introducing Postinor to your body, you are telling your body to stop producing progesterone. Please relax. I have an extra dose. And as I said, all these hormones have like a positive and negative feedback. So if your body senses that you have like progesterone, it senses it to your other hormones that, oh, now release this one. And when this estrogen is released, estrogen just believe that there's no need for menstruation to happen, so let's cease. So every time someone is using Postinor, you are abusing it almost every other time. You are practically telling your body to stop worrying about producing its own hormone. That you have an extra. And by so doing, your body is saying that, oh, I don't need to overwork myself. And it's sending like a negative feedback or a positive feedback to another hormone to now go and work. And by the time that one is being released, it's not enough. So it's just a whole constellation of what's it called? It's just a whole constellation of symptoms. Did you get? So, and that's why I always advise, please don't abuse Postinor. You can use it one-off time, but another thing you will know that your period might not come back immediately because your body just senses that, oh, you have progesterone in the body, so let me go and hibernate. So basically, what are the other hormonal options of contraceptives that is available? So we have the Implanor, we have the implants generally, and then we have Implanor and Jadel. Implanor can last for 3 years, Jadel lasts for 5 years, depending on what you want to use. And then I think it was recently, I saw someone made a post that I think it was last year, about seeing some young adolescents some young adolescents actually have what's it called? They had implants in their hand, and there was just this who do this wicked thing. It's not a wickedness. It's not wickedness. I believe that is actually even how mothers are taking responsibility, because they don't want to have a teenage pregnancy. They don't want to have a teenage girl coming down with pregnancy. You are the one who know that you can do 100% adolescent. Morality is preached in church, in mosque, and all. But how many person can adhere? How many person can do that? And that's why it's when you are preaching the gospel of contraception, don't make it because I'm a person of faith, or I'm this and this person must just abstain. You can't enforce morality on people. They have to desire it. They have to try to do it, but they have to know the reason why they are doing it, and it cannot be enforced. So why you can't enforce that, you have to give them other options, and the options are the hormonal contraceptive. You have the Implanon, the Jadel. You even have the IUD, the IUD, intrauterine device, and that one is also impregnated with hormones. And they all have their own advantages and their own disadvantages. This is like a whole topic on its own. But I just want us to know that when we see young person having contraceptives, let's not stigmatize them. Let's not also preach the message of just abstain. Because what you are trying to do is that, I always say that with holding contraceptive from young person, it's like you increasing the rate of teenage pregnancy, you increasing the rate of sexually transmitted infection, you are increasing the rate of maternal mortality. It's like it has like a rebound effect. If you say, I am telling you to abstain, please don't do any other thing but abstain, and you just say that, and that's all. I've seen a young girl that has teenage pregnancy, and not even one, not two, there are plenty, and it was so pathetic because they didn't know. They just felt, okay, I'm not on my period, so I don't think I can get pregnant, and they didn't use anything, and they saw their period the next month. And you have like a parent who is a soldier, who is already telling them, I trust my child. My child can never, because I have put the measures in place. I've been still disciplined. But discipline is not enough. The only way you can do that is because young persons are exposed to different things. The only way you can prevent a young child or a young person from having sexually transmitted infection, give the person condom. Just let them know that they can confide in you. Or you give them the option of contraceptive. We also have oral contraceptive, which are the progestin-only pills. We have the oral pills. We have the combined oral contraceptive. And the combined oral contraceptive have different hormones impregnated. It has estrogen and progestin. So depending on the type of contraceptive option, they are always available and they can be used. And let's not stigmatize young person that tells you maybe they're during the community project, and they walked up to you and they say, where can I get contraceptive? Please be open to them to let them know where they can get it. And if you are within the team that actually also, you make the options available. You don't outrightly tell them that, it's not, we don't have it. Tell them where they can get it. Tell them where they are where there will be confidentiality. I currently work in a clinic, and in our clinic, you can actually get contraceptive, like an adolescent health clinic. You can get anything that you want, from contraceptive to condoms. Everything are available without breaking your confidentiality measures. So, and this is actually what we need to also prioritize as advocates. We must ensure that we prioritize the confidentiality of our people we are advocating to, even if it's a community members that we are reaching out to. You don't just say, okay, because this person has confided in you about their body count, about their what they are currently dealing with, you now put it up in or you tell their next neighbor, or maybe you are just having a conversation and you're like, that girl, this is it. She actually recently just aborted. She just did abortion. And this is actually another conversation we need to talk about today. Abortion is another thing. It's not legalized in Nigeria, and it's not even allowed. Abortion is simply termination of pregnancy before the age of viability. But so many persons have actually even done abortion even after the age of viability. Age of viability for in Nigeria context is 28 weeks. In America, it's 20 to 22 weeks. But the types of abortion that goes on anywhere, now people are advocating for abortion rights, abortion law. I don't support abortion law, and I don't support abortion rights. Not because of my faith, but because of certain things I've been able to discover why it's important. But I don't want to talk about this conversation because it's not even in the scope. So what are the options that are available for young adolescents? And that's why I'm big on contraceptive. Let every young person have access to contraceptive. Let them protect themselves, because using contraceptive is not abortion. Because contraceptive only work by controlling the hormones before the egg and the sperm comes to meet together. And that's why it's important as an advocate. Please advocate for the use of contraceptive. Advocate that they get to use condom to prevent the increased rate of sexually transmitted infection. Sexually transmitted infection is not limited to gonorrhea. It's not limited to hepatitis B. It's not limited to HIV/AIDS. It's any form of infection that is transmitted via sex. And it can be as simple as AP simplex, the normal, I think in Yoruba, they used to say that angular stomach, this thing that we used to have in our mouths, that thing is a sign of AP simplex. And it can, I can't remember the name Yoruba, but for some person, before you get sick, you always have this, especially for people that have genotype AA, you always have this kind of like a blister in their mouth. They always have this kind of a blister in their mouth, and that is an infection. It's called AP simplex. Imagine someone having oral sex, and from just having sex with someone that have angular stomach, having AP simplex in the mouth, it can be transferred via vagina, and the person have AP simplex. It's sexually transmitted. So it's not only gonorrhea, candidiasis, so many, from fungal infection to viral to bacteria. There are a lot of infections that can be transmitted through sex, and the only way that can be protected is to use condoms. For the male sex, please use condom, because most of the carrier of these infections, they are actually male gender. So what's it called? Human papilloma virus is transmitted by sex, and that's why we always advocate for young girls and young boys to actually get vaccinated. HPV, which is a sexually transmitted infection, causes cervical cancer. Cervical cancer has been caused to be the second leading cause of death in women. And now it's not just limited to older women. As long as you are sexually active, please get screened, get to do pap smear. Protect yourself, because most young men are actually carrier of HPV. And the major cause in 98% of women, the major cause of cervical cancer in 98 to 100% of women is HPV, which is usually sexually transmitted. And that's why we always campaign, please, as much as possible, go to any public hospitals, primary health center, get girls vaccinated. So as an individual advocating for menstrual health, women's health, what can you do? Young girls between the age of 9 to 13 years, Advocacy is free in primary health center. It's free in primary health center. I know in Lut where I work, we give them for free. 9 to 13 years is free for them. For other primary health center, actually, it's actually free. But Sabaris is not free for as long as you are more than 13 years. Also, male children are also meant to get it, but it's not free for the male child, because, as I said, male gender are the carrier of HPV. In most cases, human papilloma virus. And the reason why I'm talking about all these sexually transmitted infections is because they can be controlled by the use of condom. Just wearing condom alone can protect against all this wide range of sexually transmitted infection. And condom is a form of barrier method of contraceptive. So I have a number of things to say, but one of the things I just want to emphasize today is that sexual health reproductive health, the changes that occurs in the female body, in the male body, is something that we need to pay close attention to. And just this class cannot talk about it enough. Like, it's like a compendium of different things, from contraceptive to body rights to rights of the adolescent. So it's like a whole ball game. It's very wide. So once again, I just want to establish again that adolescent is actually a group of people between 10 to 19 years. So adolescents are 10 to 19 years of young person. So they are 10 to 19 years. So it's important to have this conversation, and also to, it's important for us to know this, to know that this conversation is important, so that we won't just be doing, we won't just be advocating without having the right information. As I said, all this information I talked about, they are also age specific. The information you communicate to a 9-year or a 5-year-old girl or a 5-year-old boy is different from what you will communicate to an adolescent. It's different from what you will communicate to a youth. So it also depends on how you are able to, you put it in context based on their age group and the changes they're experiencing. I hope I've been able to, in one way or the other, communicate the basis of understanding the human bodies, especially in terms of adolescent health and sexual rights. Thank you, everybody.
Thank you so much, Ma, for this insightful lesson. Actually, I learned a lot and I made some notes. So before I would, ask some of the questions that I have here, again, thank you so much, Ma, for coming and having this session with us. So if anyone has questions, please, this is the time for us to ask our facilitator if there's any clarification we need, and the slide will be sent later on. If there are any clarifications you need, any questions you'd want to ask, please, you can ask your questions now. Thank you. And also, while we wait for the questions, I have some questions here that I would like to ask you. Can I proceed, please?
Yes.
Okay. So, when you were talking about the menstrual pain, that there is actually an hormone that controls it, you mentioned pain is not normal. Like, it's not something that we have to normalize, because it's something we've normalized in Nigeria, as it were. So my question is, what can we do about the pain? Because as advocates, we always say that, oh, pain is not normalized, you can't normalize pain. But then if they ask us questions that, what do they do about the pain? What can they do about the pain? I would like you to shed more light on that now. Thank you.
Okay, so one thing is that the way to know if the pain is not relieved by analgesic, and I'm talking paracetamol, paracetamol. For some person who don't have ulcer, they can use ibuprofen and all. If after you use NSAIDs like paracetamol, ibuprofen, or any form of pain relief, and the pain still do not go, which means it's not normal. And because we are in the resource limited community, the highest way to measure pain, the highest dose of pain relief that someone is meant to get to know if this pain is not normal is actually to get an epidural. Many hospitals actually give epidural. Imagine if after you get epidural and the pain did not subside, it's no longer normal. And but we know that epidural is not readily available. Do you get?
Yes.
So the other options someone will tell you to do is that, okay, when you go to the hospital, when they give you pentazocine, and that's one of the reasons why they don't want to give pentazocine or morphine, because it has addiction. There's this addictive, it comes with addiction. And that's why many persons want to say, you just go straight to epidural. But epidural is expensive and it's not readily available. Even in Lagos, which is thought to be like eyebrow institution, there are only few centers that give epidural. Even for people that are in labor, they still restrict giving them epidural. So to tell you how our community have actually normalized pain for women. So the only way to resolve that pain is to use analgesic. But when do we now, what makes it, maybe if someone say, oh, I use paracetamol and the pain still do not go. And I still need to do, I'm unable to do any activities. What options? The other option is epidural. So after the person I'm not getting epidural and the pain did not subside, just know that it's no longer all about menstruation. There's something more that's causing that pain, and the person needs to see a gynecologist as soon as possible.
Oh, all right. Thank you very much, ma. Because over time we've always heard about you don't have to use what's it called? You don't have to use pain reliefs because pain reliefs later on in life it blocks your tubes, blocks the uterus, doesn't allow us to give birth. So people just endure the pain and be like, okay, I don't want to have pain, or I want to experience what labor feels like, or this is the way labor pain feels like. So I tend to experience the period pain like that. But thank you very much for
Thank you. But menstruation
so
is not labor pain at all.
okay, so there is a question here that what's of in cases like endometriosis and adenomyosis or hormonal imbalance, will one keep taking pain reliefs forever, including fibroids too?
No, that I saw the question, and one of the first thing I established is I said any pain that does not stop with pain relief. Because by the time you take paracetamol, in cases of endometriosis or adenomyosis, it doesn't resolve at all. It's like you just even trigger the pain. So in that case, you need to see a gynecologist as soon as possible. Even you try fibroid, there is no amount of pain relief you take that will subside the pain. And that's why I said it's a gynecological issue. When I was talking about even from cycle length and all the changes that happen to the body, when you put all those symptoms together, when you have all those constellation of symptoms together, you don't just sit down using pain relief because it doesn't work. Pain relief will not work. In cases of uterine fibroid, it doesn't even work because the pain will be so severe to the extent that you are even having heavy bleeding. And most of the times, it's until that fibroid is removed before the symptoms subside. So in that case, you see a gynecologist as soon as possible. As soon as possible. You don't have to wait to keep abusing pain relief. No. You only use pain relief for people that have no underlying medical condition. Pain relief for someone that does not have any underlying. Person has done a scan, they've done physical examination, they have seen a doctor, and he said there is nothing. You've even done, maybe the person has done CT scan to check the abdomen, just to check if there's any other thing going on. And there's nothing. And it's just maybe just hormones. In that case, they give you other contraceptive like COCP. The CO combined oral contraceptive, especially in case of hormonal imbalance, they give combined oral contraceptives, an analog of the hormone that is inadequate. So when the hormone is given, in one way or the other, the prostaglandin will tend to subside because all these hormones work by positive and negative feedback. By the time you have the hormone already, you get to use your analgesic, and the analgesic will subside. Another thing I want to debunk is this: analgesic has no direct effect on the what's it called, on the womb. What it does is that on the tubes rather, it works on the nodule. The way we think about our womb is more like, okay, the female womb rather. Let me not generalize that everybody here is a woman. Sorry. But basically, the womb generally, it's more of like a muscle. So it has like 3 layers of muscle. And what happened in most of analgesic is that the analgesic work on the nerves, and they don't work naturally on they don't work on the system directly. They don't work on the ovary, so there's no way they will block anything. So they are working on the nerves. It causes the pain sensation to be perceived. So they work to relieve the pain, to relieve the pain sensation.
All right. Thank you very much, ma'am. So one last question that I have here is you mentioned during the phases of menstruation that sometimes, not every time, that the breast do produce breast milk because of the increased level in prolactin. But then I've always like come across, people who ask questions that is there a range of the milk coming out? Because we know, oh yes, we are not pregnant, yes, but then the milk letting, is it supposed to, go on for long or just for a short period of time? Because some people have actually complained about them seeing it probably um, all through their menstrual cycle or just randomly in the month. I would want you to clarify that, ma'am.
Actually, you are not even meant to uh, milk. Milk let down is actually is a product of the fact that the prolactin in milk is high, and it's not meant to be high. It's meant to be it's like a negative feedback. When it's high in the body, what it tends to do is that it tends to lower estrogen hormones. And that's why many persons say they have an ovulation. They are not ovulating. They don't even know when they are ovulating. And that's because the prolactin hormone has a negative feedback on the estrogen hormone. So they are having the person is going to be seeing their period though, but they are not ovulating. So the breast they'll be having breast discharge, like the milk. Normally, a person is not meant to have breast milk, except if you are about to give birth. So it's not meant to actually be there at all. So when it's there, is a sign of an hormonal imbalance. And that's why when the person goes to see the doctor, they will prescribe a combined oral contraceptive so that it can recorrect what is happening with some other medication and stop that secretion of the prolactin. So it's not meant to, what I was trying to, I see breast engorgement, like breast pain, like the breast feel full. During this whole process of the cycle, prolactin is still secreted, but it is not higher. It's not
Okay.
in low amounts. And that's why your breast feel full. But in cases when it's not secreted and it's higher, the extent that is high enough to be causing lower secretion of estrogen. In that case, the person will not be having symptoms like breast milk secretion, which is going to affect ovulation. So the person will not be able to ovulate. And then you see some person say that I'm menstruating normally. I'm seeing my cycle, but I don't ovulate. And that's why there's actually an instrument that we can use to actually detect whether you are ovulating or not from your mucus secretion during the mid cycle. As I said, no, ovulation is the mid cycle, the half of your cycle, the mid cycle. So imagine someone that is menstruating for like maybe 22 days, and on day 11, which is meant to be ovulation. So imagine day 10, 11, 12. The person, there was nothing going on. There's no sign in the body, no mucus secretion, there's no body change, nothing. The person didn't even know that he or she is ovulating. And that's because the estrogen level is very low. And estrogen is meant to be high. But the person is having breast secretion. The person will be feeling breast pain. And then by the time the person presses the breast, it's seeing it. That's the effect of prolactin hormone, which has affected secretion of that has affected ovulation. So the eggs are not released. Then the person is unable to fertilize. There's this person have infertility, but it's because of the prolactin. And it's actually a condition called prolactinoma.
Oh, All right. Thank you, Ma. So someone has a question here that what if in case where the first 2 days of the period is always accompanied by dark blood and it has been consistent for years and abdominal scan has not revealed anything weird? Is it still a sign for concern given the years of its consistency?
As long as it doesn't have clot, matter the color of your blood. I know some persons say the blood is meant to be dark red, be light pink, and all of those things. Sometimes, if you eat a lot of protein during the diet, if I'm kind of person you eat healthy, you take a lot of yogurt and all, your blood will be dark. Even most of the times, dark blood, like dark brown, is a sign of that. That's actually the normal color of the blood. It's when it's becoming light, when it's lighter, it's even a sign of anemia. When it's becoming very darkish, it's a sign of maybe it's about to be forming clots. And then some person will straight into hemophilia, like the person is producing excessive blood. So there are so many things, but it's not something to worry about. The major thing, as I said, I used to say there's something wrong with your cycle, is with your blood control, with your menstruation generally. It's not just a one-off thing. It's not just all about. It's like a constellation of three things. Is your period short or longer over 3 months? Is the blood volume, like how much pad do you use? Are they always doing so? Like you're using 3 pads within maybe 12 hours or 8 hours. This pad within 8 hours, and all those pads are fully soaked to the extent that you even get stained. Does your contain blood clots? Blood clots to the extent that they are huge enough, even when it come out from your body, you feel like you can feel it. So those are the tests. So it's not just it's not a one-off thing of okay, that's the color. So it can be color, volume, and duration. So it can be two like that, but not just one-off thing. And that one-off thing also have to be, even if it's one-off, it must be something that has been happening for like 2 or 3 months. But color is not like relative. So color must go with something else. Color must go with like maybe duration. Color must go with like volume. So it's not just color alone. So it must be like now that you are coming, like someone has said this dark blood. So the must be dark blood with what? Maybe dark color blood with heavy bleeding, or maybe dark color with for more than 7 days. You get, so it can be like a puncture. We're just saying dark color, and this has been happening for years. It's normal.
All right. Yes, thank you very much, Ma. So there's a question here, and I think you've mentioned it before. Maybe there was network glitch. So she said, how many days is too short for menstruation, and how many days is too long for menstruation?
Average is 3 to 7 days. Anything less than 3 days or more than 7 days for 3 consecutive months is not normal. So let me give an example. Someone menstruated, like I menstruated 3 days this month. Next month, I see it 2 days. The next coming month, I see it again for 5 days. Maybe another month again, I see it for 3 days. And then I see it again for 2 days. It's not consistent. But something that is happening consistently for every time you're menstruating. Maybe someone sees 1 day today. Next time, the person sees 2 days. The next time the person is seeing like another, you see 10 days menstruating like that is not normal. So anything less than 3 or more than 7 for 3 consecutive months is not normal.
All right, Ma. So I think we still have two more questions here. One is, how can ulcer patients control menstrual pain, knowing that most pain relievers recommended for cramps are not really safe for ulcer patients? And then the second one said, are there any particular food you would advise people to avoid during menstruation from a medical point of view?
Yeah. Okay, so for as so what we used to advise is because of the pain relief, you take it along with your omeprazole. So like your ulcer medications, you take it along with the pain relief. But as much as possible, you don't give ibuprofen because it can make it worse. So you can imagine taking paracetamol, but you now increase the dose of the paracetamol. Like paracetamol is meant to be taken maybe morning, afternoon, and night. You take it when you're having the pain. So you don't take it as a routine that, oh, I'm taking it morning, afternoon, night. So you take it only when you have the pain. And another thing, as I said, is that you take it together with your ulcer drugs. So you don't take it alone. So in regards to, are there any particular foods you would advise people for during menstruation? Sugary things. I understand that during menstrual period, that is when you have a lot of cravings. So what are the other options? Because sugar actually increase it increases the prostaglandins. Prostaglandins are the one responsible for pain. So they cause pain in the muscles, the legs, everywhere. And sugar is actually a form of don't let me they are like, don't let me say endotoxins. They are not toxins, but it's like it triggers prostaglandin. It's heightening prostaglandin. So what do you do? Especially the industrial sugar, you replace it with something like watermelon, pineapple. They are healthy source of natural sugar. So it doesn't make the pain worse. That's just it. So if you take something like pineapple, watermelon, something that has a lot of fluid as well. So you take a lot of fluid, you take a lot of pineapple, a lot of watermelon, sugary things, but healthy sugar.
All right, ma. Thank you very much. So I guess that would be all for tonight. Thank you so much for coming and for having this interesting session with us. We hope next time we need you, would call on you and you answer us. Thank you very much, ma. That's so grateful.
You're welcome. Thank you so much.
Yes, ma. So we're going to take a short break now. So we'll come back for our next session by 7 p.m. And attendance also is compulsory for that. Thank you, everyone. And we'll see by 7 p.m.